everyone. I'm here today to talk with you all about a case study that has been done regarding non-invasive ventilation. And this study is based on patients with COPD and chronic respiratory failure. So this is the first study to be done in the U.S. of this kind, and will be released in a couple months. So we're really excited to be able to share this information with you because for the longest time, actually since 2012, we have been educating as much as we can on non-invasive ventilation and trying to convince doctors and other healthcare professionals that non-invasive ventilation for these COPD patients with chronic respiratory failure is the best type of therapy for these patients. So we see this because we work with these patients hand in hand. So this has always just been a trust and word with the doctors, and also our patients going in telling the story about them using their Trilogy machine and how much better they feel and how it has helped with their disease. So this study was actually done by a third party, KPMG. They asked Medicare to release some documentation as far as claims that have been filed throughout 2013 to 2016. They asked for patients that had a diagnosis of COPD with chronic respiratory failure that were not put on non-invasive ventilation, so untreated patients. And then they also asked for documentation to be released on patients that are being treated with non-invasive ventilation that have the diagnosis of COPD with chronic respiratory failure. So basically we were able to cut this down into 3 groups, and Medicare will only release 5% of their data, and there's no way around that. So just remember that when I give you these numbers, it's only based on 5% of these Medicare patients that have COPD with chronic respiratory failure. So the untreated patients, the number of untreated patients that have chronic COPD with chronic respiratory failure is 14,230 patients. So remember, again, this is only 5% of those patients. Huge number. This is our big challenge, is getting out there and getting these patients the therapy that they need. So then Medicare released the documentation of these COPD patients with chronic respiratory failure that are being treated. 112 of those patients ended up being our patients, biomed patients. So then the other 1,266 were patients that are with other suppliers, our competitors, that actually are on non-invasive ventilation. So on the second page of your handout, you'll see these cohort sizes. And then if you turn to the third page, this starts out with mortality rate. So throughout this study, there's 3 questions that they basically direct this study toward. And this is, does non-invasive ventilation decrease mortality rate? Does non-invasive in COPD patients, and does non-invasive ventilation actually cut healthcare costs? Does setting a patient up with non-invasive ventilation actually help with hospitalization rates? So we actually have all those results here for you, and I'm going to go over these with you now. So this the results as far as mortality rates, this is actually really exciting for us. This shows you that from the 1st week to the 6th week that a patient is set up on therapy, you can already see a drastic decrease in mortality rates in these group of patients that are treated. So you'll see in the orange your untreated patients, in the green of course is your treated patients with the biomed patients combined. So you can see that after week 6, it shows a 16% decrease in mortality rate in these patients that are on non-invasive ventilation. So, and after you get to the 6-month mark, you will continue to see the 16%, which is the absolute value. So between the 1st and the 6th month, we're actually able to decrease the patient's mortality rate, by 16%. So as these patients continue on therapy past those 6 months and continue to be compliant, we are actually showing that there is a decrease in mortality rate by 42% with patients that are on non-invasive ventilation. So with that being said, if you were to pull up statistics on these COPD patients at this time, it will show you that within the first 6 months after a patient is diagnosed and is untreated, does not start on non-invasive ventilation, that they have a 38% mortality rate. So, and then it goes from a year of being diagnosed to a 50% mortality rate. So this shows you, yes, after starting a patient on non-invasive ventilation, we do see that decrease in mortality rate. So the second question that we come across is healthcare costs. Does non-invasive ventilation decrease healthcare costs? Yes, it does. So on the 4th page of your handout, you'll see a total of 1 year cost. So this is per group. So for untreated patients, you'll see $80,653 per year spent on these patients. And then for a total year cost for biomed patients, it's only $55,735. So we're saving the system over $25,000, and we're also $25,000 above and over the untreated patients as well. And the comparison between our competitors, they had a cost of about $71,887, and again we had $55,375. So the difference there is about $16,512 difference. So we're able to save that over our competitors. So these results show you that yes, we can actually save money on healthcare by setting a patient up with non-invasive ventilation that has COPD with chronic respiratory failure. So if you turn to the last page of your handout, we get to the hospitalization rates. Can we actually decrease hospitalization rates by setting patients up on non-invasive ventilation? So if you just look at the 3 groups again, your untreated patients, it's about a 25% hospitalization rate. So your patients that are untreated, there's a 25% chance that after 6 months they're going to end up in the hospital or back in the hospital. And then for the other vent suppliers, our competitors, they're just right underneath these untreated patients at about 24.41%. So your biomed patients, the hospitalization rate is actually a little below 20%. So we're right at 19.62%. So the reason that we are the lowest is because you're not just ordering the non-invasive ventilator for your patient. You have a respiratory therapist that is on call to these patients 24/7. If they need a pressure change, if they need a different mask, we're always there for that patient to make them comfortable, to make them be able to breathe easier, and to keep them comfortable so that they don't have to go back into the hospital, and we're able to treat these patients in the home. So that's just summarizing some of the findings of this study, and also some other key findings are that they found that for every 6 patients that we set up on non-invasive ventilation, we're actually able to save 1 life. So in retrospect, if a patient goes in to their family physician and the physician sees that this patient has high cholesterol, Well, for example, Lipitor is a drug for high cholesterol. So this patient is going to, or the physician is going to write a prescription for a patient for Lipitor and for that patient to decrease their risk of having a heart attack. So this doctor has to write 70 prescriptions for Lipitor to be able to save one person from having a heart attack. And then also in comparison, the flu shot, that's standard care. Most people get their flu shot. So for every 50 patients that get their flu shot, they're only able to prevent one case of the flu. For every 50 patients that get their flu shot, you're only able to prevent one case of the flu. So again, for every 6 patients that we set up on non-invasive ventilation that have COPD with chronic respiratory failure, we are able to save one life. So our main goal here is, now that we have the clinical documentation that we needed to back ourselves up, to tell you, yes, non-invasive ventilation is the treatment for these COPD patients with chronic respiratory failure. And it's nothing for a physician to write an order for CPAP because a patient has obstructive sleep apnea. It should be nothing for a doctor or another healthcare professional to see a COPD patient with chronic respiratory failure and be able to start these patients early on therapy, or just start them as soon as they see that these patients are able to qualify for the non-invasive ventilation. This should be standard of care. It's underutilized, and our main goal is to push this for our COPD patients.